All right, good afternoon, everyone. Before we get started with the report presentation today, I wanted to hand it off to our CEO, Shyla Ulrich, to give a few remarks.
Good afternoon, everyone. Thank you so much for taking time to join us today for a really important event, the Hunger Mapping launch, which is really exciting. This project includes the contributions of neighbors across this entire county here in Adams County. Our neighbors' voices and experiences are featured throughout the report and form the basis and main findings and corresponding recommendations. This is an in-depth study of food insecurity in the county and the work of about a year of time, right? So very, very long time, it feels like. This project has been a true community-based collaboration conducted in partnership with Healthy Adams County, the Adams County Food Policy Council, and our partner agencies across the county, including SCAP, who's here. If you're here from SCAP, give a wave. Hello. And New Hope Ministries. I know we have a couple of folks from there, wonderful, who contributed to the report. We invest in hunger mapping as the Central Pennsylvania Food Bank because these reports provide the data and recommendations to inform the future direction of the charitable food system across our service territory. It doesn't take long for readers of these reports to find themselves in the pages. I know I see myself represented as a WIC and SNAP recipient as a kiddo, as a volunteer of a pantry, and later an operator of that same pantry, and now as a supporter and cheerleader of this work to our internal team and to the agency partners and community stakeholders who invest in this work. We are all community members where hunger happens, and these reports provide a guiding light for how to be helpers, no matter where you are represented in these reports. When Zach and his team invested time into Lebanon County, where I had the privilege of leading a pantry, I was able to use these findings to recalibrate food purchasing procedures to account for an increasingly diverse population at our pantry. In just a little over a year, with the encouragement of this report, we were able to see a positive change of individuals reporting always or often receiving items they desired rise by 11 percentage points, something that wouldn't have been able to be realized or measurable or attainable without this fantastic team helping along the way. So without further ado, I'm going to pass the mic over to Stephanie Voigt. WellSpan has been an incredible contributor to this work, and we couldn't do it without the support of WellSpan, so I'm going to pass it over to her. So thank you.
Hi there. Can you hear me? I feel like I need taller heels here. I need some heels. Well, good afternoon. I'm Stephanie Voigt, and I am the System Director of Community Health at WellSpan. I'm honored to be here today to celebrate what feels like sort of a big milestone for us in addressing hunger collectively, collaboratively in Adams County. WellSpan's Community Grants Program is really proud to have sponsored the Hunger Mapping Project in Adams County, and we're eager to work with everyone here in continuing our work on food insecurity, hunger, and the many other non-medical factors like transportation and housing that we know are impacting our community. In total, WellSpan has invested roughly $150,000 in the hunger mapping projects across the region because we're so committed to this work. For many years, WellSpan has screened millions of our patients for social insecurity, so for food, for housing, for transportation. By collecting this data from our patients, we learn a lot about how social insecurities impact health outcomes. We have definitely learned a lot. To start, patients who are food insecure accrue healthcare costs that are 2.2 times higher than patients who are not food insecure, and that's dollars that are distributed both within the patient and within us in healthcare. When comparing food insecure patients to the general patient population, we also know that patients who are food insecure are 8 to 10 times more likely to have uncontrolled diabetes, 2 to 3 times more likely to have a medical history of hypertension or coronary artery disease. Food insecure women are 3 times more likely to have a medical history of gestational diabetes. And then food insecure children are 4 to 6 times more likely to be obese. And food insecure patients overall are more likely to have an emergency room visit, more likely to have a hospital admission, or also have an incomplete appointment. So I'm saying these stats to you and I see heads nods because none of these probably surprise you because we're all partners and advocates for change and hunger. These statistics, along with the report that Zach and the Central Pennsylvania Food Bank team will share, remind us of the circumstances in our own local community, however. So often when we read those stats at a national level, it just doesn't resonate in the same way as it does when it's our community members, our neighbors, our friends, our acquaintances. The difference between reading about food insecurity at a national or international scale and seeing that local data is that it reminds us of the significance of the challenges in our own community. In a conversation I had yesterday, actually, with a local farmer, we were talking a little bit about the decline in the purchase of his healthy local fruits and vegetables from a CSA and a farm stand that he runs. And it was interesting because our conversation didn't really focus on taste, it didn't focus on quality, it didn't even focus on availability of the fruits and vegetables. It focused on cost. Our most recent community health needs assessment had a really core theme, and that was that residents in Adams County and around the region are worried about cost. And when we say cost, that includes the cost of food, housing, healthcare, prescriptions, transportation, you name it. So in an era where cost is such a significant issue, concerns about the cost of food continue to plague our community. So we remain focused on food insecurity at WellSpan, and we've turned some of our attention to the impact of non-medical factors like food insecurity and housing on life expectancy. We're committed as an organization to improving life expectancy, and we know that this doesn't happen strictly within the walls of our hospital or within healthcare. Non-medical factors like food and housing impact life expectancy, with research estimating that food insecure community members' life expectancy is at least 5 times less than someone who is food secure. And that doesn't consider the impact of poor nutritional value of foods that are being consumed by some of our food insecure families. The case for action on food insecurity, I know I don't have to say this in this room, it's abundantly clear. I'm proud to say that in the last 3 years, WellSpan's invested about $2 million in efforts to improve food insecurity and security. The funding has focused on core programming and partnerships to address needs within the charitable food distribution system, improving WIC enrollment, and research projects like the Hunger Mapping Project. Adams County is already doing exceptional work in this space, and WellSpan's been so proud to support some of the work. So we've supported the SCAP Gleaning Project, the Healthy Options Program, the Fruit and Veggie Bucks Program, and the Double Dollars Program, just to name a few. And I mention those not because of WellSpan's interest in them, but because it's just phenomenal work that's already happening in Adams County. You all are doing great work. We see the completion of the Adams County Hunger Mapping Report as an opportunity to build on that great work that's already underway. Tools like the Hunger Mapping Project provide critical background to ensure that our work is as effective and efficient as possible, and it equips us with the data to keep us improving. As Peter Drucker once said, "Today knowledge has power. It controls access to opportunity and advancement." I look forward to leveraging our learnings today for just that, opportunity and advancement in Adams County. So thank you, Central Pennsylvania Food Bank, for your leadership expertise. Thank you, community partners, for staying the course and seeking opportunities to innovate in a collaborative way. And together we can make a difference, we can keep making a difference by ensuring all of our neighbors can have access to healthy and nutritious food without barriers. So together, we'll build a healthier Adams County. Thank you so much.
All right. Thank you so much, Stephanie, and thank you to WellSpan for their investment in this work. Good afternoon, everyone. My name is Zach Zook. I am the Chief Strategy Officer at the Central Pennsylvania Food Bank. I am absolutely thrilled today to be presenting alongside my colleagues, Dawn Watson, our Neighbor Insights Specialist, and Morgan Flood, our Policy Research Specialist, the results and findings of our Adams County Hunger Mapping Report. So as Shiloh mentioned, this report represents over 12 months of research into the food insecurity situation in Adams County, and we're really hopeful that the report today represents a strong understanding of the food insecurity situation and what we can do to combat food insecurity together going forward. Before we get started, I also wanted to do a quick shout out to our other co-authors, including Ashley Lucas and Evan Armstrong. They were both critical to this work, and every single author contributed in a major way over the last 12 months. Also wanted to thank our Adams County Food Policy Council, our Adams County Consultative Group, which was made up in large part of the Food Policy Council members, and all of our partners across Adams County who do amazing work, and we're just amazing collaborators across the timeline of this project. So So before we dive into the findings and recommendations, we first wanted to establish what are our goals with community hunger mapping, what is community hunger mapping, and why do we invest in this research as a Central Pennsylvania Food Bank? Why do we think it's important for our collaborations? Really, our goals, in addition to understanding the food insecurity situation, is to first and foremost prioritize neighbors. Everything that we do focuses on how we can improve the food insecurity situation in Adams County with a focus on the dignity and uplifting of our neighbors who face food insecurity across the county. We are also really focused on building relationships, including with our partners, but with other stakeholders, including everybody here today and beyond this room, to reduce food insecurity in the long run, because we know that we can't do it alone as a Central Pennsylvania Food Bank. You also notice throughout the report, if you're able to pull up the report via the QR code in your packets today, or if you have a full copy, there's a lot of data analysis, there's a lot of maps, graphs, tables, charts. All of these things contribute to our understanding of food insecurity, and they're all focused on how can we turn that understanding into actionable recommendations. So we have a major focus on action throughout the report. And the Central Pennsylvania Food Bank is committed to implementing in partnership with all of our partners the findings and recommendations here today, and to continuous improvement and being able to measure our progress over time. So community hunger mapping projects, we divide them into 4 different sections. The first is our focus on food insecurity at localized levels. Second, we'll do a deep dive into the charitable food system in Adams County, what's going really well, which there are a lot of things that are going really well, but also what are the things that we can work together to improve. We'll then turn to government program utilization, things like SNAP, WIC, school meal programs. All of these have a huge impact on reducing food insecurity in Adams County, and we'll take a deep dive into areas that we can improve there as well. And finally, we'll finish with intersecting and upstream issues. As Stephanie mentioned, we know that food insecurity is a critical social determinant of health, but it's also caused by a variety of other things like economic factors, and is in itself caused by things like health conditions and housing burdens and a variety of other issues. Our report itself took 4 different steps. Today is the completion of the final report, step 3, and step 4 is what we hope to be our ongoing collaboration to implement findings and recommendations. I'll explain the next 2 steps on the following slides. First, we did a secondary data analysis, and our most intensive phase was our primary data collection phase. So on the secondary data analysis phase, we at the Central Pennsylvania Food Bank have developed a series of rigorous analytical methods where we're able to take data that's available at a national level, and that is localized data, and really apply that to increase our understanding of food access across the county. So that has included utilizing data from Feeding America, from the USDA, from the Pennsylvania Department of Health, Pennsylvania Department of Human Services, and the American Community Survey. And we take all of that data and apply it using these methods. The first is our census tract level network access analyses. You can see some of the results here on this map to the left. So essentially what we take is we use census tracts as a unit of geography because they are relatively even in population across the county, and in Pennsylvania they largely correspond with municipality borders. So they make it a useful unit of geography to talk about, and more useful than zip codes in many ways. We do a 15-minute drive time radius of each census tract centers of population, and that allows us to calculate things like the number of food pantries per census tract that people might have access to. It also allows us to calculate the number of food insecure individuals per pantry, so we can understand if there's potential gaps or areas that need more support. And we're also able to calculate things like weekend access and evening access and access to choice pantries that are where people can choose the foods that they like and want. On the localized participation gap analyses for our government programs, we take a wide variety of data, as I mentioned, and we apply them for SNAP, WIC, and school meal programs to better understand where and how we can increase participation across the county. Our primary data collection phase, again, it's our most intensive phase. That has included working at 5 pantries across the county, conducting household level surveys. It's included non-participant observations at other pantries, non-food pantry location surveys, and of course listening to our partners who are doing this awesome work across the county. That included food pantry surveys, listening sessions, and a consultative group that was with us every step of the way. So our agenda for the rest of the presentation, again, it largely follows the outline of the report. I will go over the food insecurity situation in Adams County, and then I'll hand it to my colleagues Dawn and Morgan to review the remaining sections of our report. And finally, we'll finish up with implementation and next steps. So turning to the food insecurity situation in Adams County, it's kind of blocked off by this thing at the top here, but nearly 12,000 people experience food insecurity in Adams County. That's a staggering number of people, including more than 3,000 children, and that equates to about 1 in 9 folks in Adams County, which is a large percentage of people, although I'll note that it's lower than what we see in neighboring counties. It's also important to note that children and households with children are far more likely to experience food insecurity than other household types. So in Adams County, children have a food insecurity rate of 14.9%, which is 45% higher than adults across Adams County. This means that it's particularly important to focus on households with kids when we think about ways to increase access to food and nutrition resources. Also note that Hispanic and Black neighbors are more than twice as likely to face food insecurity as non-Hispanic white individuals across Adams County. And there's a variety of other details throughout the report on the food insecurity situation and disparities between specifically households with kids, adults, and a variety of other individual types. So I'll mention as well that the disparity between children and adults is very large in Adams County, but it's, again, not as large as what we see in other counties across the state. So Adams County largely has food insecurity rates that are lower than the rest of the region, but it's still a significant issue impacting nearly 1 in 9 individuals. At the census tract level, I think the key takeaway from this slide is that food insecurity affects every single community in Adams County. No municipality, no community does not face food insecurity, and that's really important because these findings and recommendations and what we do about food insecurity impacts our neighbors and every single community. So the lowest food insecurity rate in Adams County is 6.3%. And the highest is 16.4%, which is a large range, but still shows that everybody has an issue with food insecurity across the county. And I'll note that McSherrystown and its surrounding areas have the highest food insecurity rates at about 16.4%. Turning to the number of food insecure individuals, McSherrystown similarly has the most food insecure individuals across the county at 800. But there are several other locations across the county that have more than 500 food insecure individuals. I won't read that list here, but it includes areas like southern Gettysburg, Carroll Valley, and Littlestown. Looking at food insecurity over time, again, Adams County is impacted by a lot of the same trends that we see at a statewide level and that we see at a national level. So these food insecurity rates over time is not unique to Adams County, but the results are particularly acute. So the overall food insecurity rise in Adams County has been 50% since 2021. Which is just a staggering increase in food insecurity. That's the result of a variety of different things, primarily looking at inflation was a big issue post-pandemic, of course, that increased food insecurity. But I'll also note that real public policy decisions that we have made as a society have resulted in these increased food insecurity rates. So you can see in 2021, food insecurity actually dropped in a major way for households with kids and for children. That was largely the result of the expanded child tax credit, which provided $300 per month for households with kids under the age of 6 and $250 per month for households with kids ages 6 to 17 in 2021 alone. Unfortunately, it expired after 2021, so any positive impact was reverted and then compounded with the impacts of inflation. We see that food insecurity is at rates that are higher than our pre-pandemic levels. So I think what's important to note here is that our decisions that we make do have a major impact on food insecurity as a community, as a nation, and that public policy investments have been shown to be able to reduce food insecurity in a significant way. Before we go into the results of our specific research at pantries across Adams County, we wanted to define food insecurity because we thought that this is really helpful as we go into our discussions about hunger throughout the rest of the report. So food insecurity, as defined by the USDA, is actually made up of 2 different components. The first is low food security. That's characterized by a reduction in the quality, variety, and desirability of someone's diet. And very low food security is characterized by all of those things because of not having enough money for food, but also a reduction in the quantity of food intake. So very low food security is our closest measure that we have to hunger in the United States. And as a charitable food system, I think as just community members, we can all agree that we want to work together to end hunger in our communities. And so we believe very low food security is our best measure of the situation and how we can work together to measure our progress over time. So among pantry visitors in Adams County, 30% experience very low food security. That's nearly 1 in 3 individuals who visit food pantries who still report that they reduce the quantity of their food intake on a regular basis. And I'll note again that there were significant differences by household type. So households with children were far more likely to face very low food security, a rate of 41%, compared to senior households who had a rate of very low food security of 20%. This matches trends that we see across all the counties that we've done this research in. Because specifically working age households with kids face a variety of challenges like the precarity of the job market and less governmental support for those demographics. Overall, as I mentioned on the previous slide, we believe that targeting very low food security is really our gold standard. We want to make sure that we can reduce measures of very low food security because that is hunger in our communities. So the rest of our report is really focused on the 3 areas that we outlined previously: utilization of the charitable food system, government nutrition programs, and upstream issues. How can we utilize each of these 3 pathways and the things that we can change in each of these 3 pathways to affect and reduce very low food security? So the rest of our presentation will be really focused on how we can do that. And with that, I will pass it off to my colleague, Dawn, to talk about the charitable food system.
All right, hi folks. Hang on a second here. I got to do some moving around of things on this screen so that I get it the way I like it. Okay, so here we are. I get to talk about some great stuff, the impact of the strong charitable food network here in Adams County. One of the greatest things about this research is that we are able to learn so much about how our charitable food network impacts the lives of neighbors. With this information, we can identify strengths and celebrate what is currently going well, and we can examine areas of opportunity where we can do more to get things right. Often food pantries haven't had an opportunity to share much about their day-to-day work with the food bank, and facilitating those conversations has been helpful to build a more collaborative and responsive network. Food pantries, they make a difference for neighbors. This is one of the most important findings in the entire report. Families that are able to visit food pantries more than once per month reduce their experience of very low food security significantly. This means that the work that is being done is making a difference in the lives of neighbors. All pantries in Adams County reduce very low food insecurity significantly, and they make a particular difference for households with children, who, as Zach has stated, are already the most likely to face very low food security. This effect increases as visit frequency increases. So a recommendation that the food bank has is that in order to maximize this impact, all households should be able to access at least 2 pantries or 2 pantry distributions per month. Next, we turn to geographic access and choice pantry access. Have some great news about this as well, about neighbor access in their specific census tract. So this 15-minute drive time shows us that, the level, the number of people who are experiencing food insecurity per pantry is relatively low. It's manageable. The pantries are generally able to meet that need. The existing pantries can serve the people who are eligible for services, but these dark blue areas on the map are an opportunity to potentially expand pantry services and ensure that folks who are living in those areas have the kind of access that they need to make this meaningful difference in whether or not they are experiencing hunger. In regards to choice pantries, individuals who have access to choice pantries on a monthly basis in Adams County, relatively high. And a choice pantry, and for those of you who are maybe not familiar, those are the ones that are usually set up similar to a grocery store. It has shelves. People can go in, choose the items that they want, and leave behind items that they feel that they cannot use. Neighbors do consistently say they like this, and they like this style of pantry because it allows them to take only what they need and leave other things for other people who may need it more. The county's widespread adoption of choice model also contributes to that satisfaction with what the pantry has to offer. Shyla had mentioned in her experience about people getting foods that they often or always like. In Adams County, 60% of neighbors told us they often or always get foods that they are looking for when they visit pantries in Adams County. It's an excellent strength. Thinking about when people can go to a food pantry. Relative to other counties, 79% of residents having access to a distribution during evening hours, that's really good. We do, however, have an opportunity with weekend access. This is an area of great need, and this off-hours access is especially important for the households we are already understanding to be under the most pressure, households that have kids and households who work. Although some pantries might be open multiple times Monday through Friday, they've got hours at 9 to 3, 9 to 4. That's not helpful if you work until 5. And so this is an immediate opportunity to say, what can we do to make sure that this is something that is either more geographic access, or there's one pantry willing to cover the entire county and get people in. A lot of different opportunities and different ways to solve this problem. As a reminder, we've done some of this research in a number of other counties, and one of the great things about having this discussion and starting these talks is that you'll come up with what works for you guys. And we'll celebrate that. And then we get to tell the next county, well, this is what Adams County did. And it becomes this collective effort to say, what can we do? What can we try? What can we see that will happen and that will work well? So thinking about the neighbor experience at food pantries, we ask some questions about how does it feel to go to this food pantry? How do you feel about the food? How do you feel about your treatment? And one theme that consistently comes up is just paperwork, documentation requirements. And this is also something that volunteers and pantries will say. Everybody's just drowning in paperwork. And it's exhausting, right? And some of that paperwork does come from us, and we know that. But it's one of those things, but reducing the documentation, right? It increases access for people who need services. If the requirements are simple, if it's easy to understand, if it's easy to follow, that is better for visitors, it's better for volunteers. Once you establish those things, it becomes second nature. And this can be even more important for pantries that are serving populations for whom maybe English is a second language, just so that signage is clear, it's in the language that people can understand, and if possible, you have volunteers who are able to communicate. I would like also to celebrate the good job that our Adams County partners do in just creating a generally really pleasant visiting experience for neighbors. This has a lot of different facets to it. It's how the pantry looks. Is it clean? Is it well lit? Does it look like a place that only poor people go? And you know what I mean when I say that. People are, our organizations are working within some of the spaces that they have available, but a lot of them have made the spaces so nice. We have a pantry who's working out of sort of a reformed garage situation, and it doesn't feel like you're going into, some place that is a wrong place to go. It's open, it's welcoming, things are signed clearly, the people who are there at the pantry are welcoming. Several pantries note that they have snacks and coffee available for people, so that it's not just sort of a, run in, grab your food, and get out as quickly as possible. It's not embarrassing to be there. It's a community resource. This goes a long way to destigmatizing what it means to go to a pantry. When we have folks, and we have these numbers of food insecurity that are starting to rise again, people need to have access to this resource, and they need to know that it's not going to be embarrassing to go and do it. And I think Adams County has got that. They've got that figured out, and you need to continue that work, and then tell other people about how you do it too, because it really does make a difference, and it really does matter. You can have the most beautiful pantry in the world, but if nobody wants to go, it's not making an impact. So thank you for the work that you're doing. Thank you for the work that you're doing and the fact that it's difficult right now. Food pantries, in our listening sessions and my one-on-one conversations with coordinators and other programmatic folks at the pantries, they're reporting that they're struggling with insufficient resources to serve neighbors. They're stretching dollars to meet the needs. And pantry visitors don't know about this. They don't know about fundraising. They don't know about the food ordering logistics and all of that. They just know if the shelf at the pantry looks empty or full. And I think pantry coordinators, are doing an excellent job at bringing as much food as possible to their communities. But, we're working in an environment where there have been cuts. And cuts to federal funding have had a major impact on how pantries and our food bank are able to serve neighbors. Delays in the state food budget, that is creating a lot of uncertainty about how organizations will continue to operate. And this is a great thing to bring up to your state legislators. We need to advocate for a resolution to the budget standoff because that funding that we're waiting on supports state food purchase program, our Pennsylvania agricultural surplus system. These are the programs that are the main programs supporting food pantries in central PA. This is an opportunity to, when you leave, send an email, call your legislators and say, hey, what are we waiting on? I just heard that people are hungry, let's do something about this. As part of the survey we administer in community hunger mapping, we ask folks to share with us any comments or ideas they have about the pantry. And we know from all of our research that many neighbors like this, they see their local food pantry as a friendly place to go. And this is just a resource that we hope more people can utilize. So not only do we talk to the food pantries, okay? And we talk to the people who visit the food pantries, and we talk to the people who work with the agencies who work with the food pantries. We also try to talk to people who don't go to food pantries. We try to talk to anyone who will talk to us, essentially. So we're trying to connect with households who are not currently visiting food pantries. And results from this survey, it's a very short survey. We ask the questions that allow us to determine if people are experiencing food insecurity. And then we ask them, do you go to a pantry, yes or no? And if not, why not? So people who screened food insecure, who are not currently going to a pantry, said, they don't even know. They're not sure if they're eligible for help. Others said the hours don't work. And that makes sense when you consider that if there's households who are working, and if the evenings or weekends are their only options, the options are limited right now. And these results really just show that we need to do more to promote what Adams County has to offer so that people know what's available to them. Sometimes this information is available online. That's great. The information has got to be up to date, it's got to be accurate, and has to be easily understood. One of the large challenges that we have when we start to put together all of this information is when are places open, what days, what times of day, and it changes, it shifts. And that can be very difficult to keep track of in one place. And so a dynamic resource that people can access and that is updated frequently is like the best way to do this. So I get to do the next part, start and introduce then to Morgan talking about government nutrition programs. So I get to talk about the government. And we know from national research and from our survey results that our government nutrition programs reduce very low food security. So it's critical that we work to maximize participation rates. Programs like SNAP, programs like WIC, and our child nutrition programs across the county. So we start by talking a little bit about SNAP. That's your food assistance program for low-income households. And SNAP participation overall is typical for food pantry visitors in general across all of our hunger mapping. We like to point this out because sometimes there's this perception that everybody at the food pantry is also getting SNAP. And that is not the case. It's generally around a little less than 50% of people who are visiting food pantries are receiving assistance from SNAP. Adams County in particular is ranked 58th out of 67 counties in SNAP participation. That's low, not high. And so there's a gap here that we can work on to address with people who are likely eligible but haven't applied, people who are visiting pantries and might be eligible and haven't applied. People are oftentimes eligible for both types of assistance and can and should receive it. So another thing to note with this is that low SNAP participation, it's not just neighbors who are missing out on this resource. It's also our local farmers, our producers, our grocers. They're missing out on SNAP revenue. And I would say the exception to that is Adams County, like the double bucks for food, because our Healthy Adams County team does a really a fantastically good job of promoting this program and getting people signed up. And so farmers markets are seeing a lot of that revenue because they do such a good job of promoting, advertising, following up again, following up some more, and taking care of all of that. It takes an effort, but once people get into the habit of utilizing these programs, they tend to try to stay enrolled. And so that's a resource that's been available to folks and is going particularly well. So WIC participation. WIC is Women, Infants, and Children. That's our young children and households with young children nutrition program. Adams County, great job. Great results, reaching a majority of eligible households, probably using a lot of different methods for that. Some counties use mobile, some counties just have a presence in areas where they know where to go. So 84% of likely eligible Adams County individuals are participating. 84% is not 100%. So if you really want to do more, this table can tell you where to start, where to look, where to go, and we're happy to discuss that further. This is the highest rate, 84% of any county in which community hunger mapping has been completed so far. So if you want to keep that, keep going, keep up the good work, and we appreciate that this work is successful and going well. And from here, I will hand it to Morgan to talk about our child nutrition programs. Thank you.
Oh, of course. Yes, of course. So, hi folks. My name is Morgan, as Dawn said. And I am here to talk to you about school lunch, and among other things. So Dawn just spoke a little bit about how awesome, how well Adams County is doing with WIC. And so that is serving children under 6. But what happens to those kids when they go to school? Well, unfortunately, there's some room for improvement in Adams County, particularly around school breakfast. So if you take a look at this chart up here, you can see that Adams County has seen a significant growth in school breakfast participation over 2019, which is the last year before the pandemic, the last year where we have reliable data basically about what was going on with school lunch and school breakfast prior to the pandemic. But that growth is primarily the result of the fact that the school breakfast participation rate in Adams County before the pandemic was 15%, which is really, really low. It is the lowest that we have seen in a community hunger mapping project so far. Good news is that 70% growth rate is fantastic. So now a little over a quarter of Adams County children are eating breakfast at school, but this is still lower than the statewide average from 2019. And so there is some significant opportunity to improve here. We think that one of the reasons for this, and I would love to, I know we have some school food authority folks in the room, I would love to chat with you after this. We think that part of this is that there are lower implementations of alternative breakfast service models in Adams County than in other counties. According to data that I have from Pennsylvania Department of Education, about 60% of the schools the public schools in Adams County are using an alternative breakfast service model. Statewide average for that is 73%. And additionally, of the schools that are using an alternative breakfast model, meaning they're offering breakfast after the bell, they're doing breakfast in the classroom, they're doing second chance breakfast, later service, that kind of thing. Of the schools that are offering that, only 6 out of the 14 that are doing alternative service models at all are doing breakfast in the classroom, which is the most effective model in terms of increasing participation. So there's some opportunity here, and as Dawn said in regards to SNAP, this is revenue that school districts are leaving on the table too, that really could help support their food services more broadly. I do want to take a second before I move off of school lunch also to give a special shout out to Bermudian Springs School District. I don't know if anybody from there is here today, but they opted into the community eligibility program, which allows the school district to provide food to every kid in the school district free of charge without paperwork. And they did this even though they are at a threshold where the school district has to make up the difference in revenue from what they would have been receiving from lunch cost shares effectively when they were still collecting paperwork. So this is an investment that the school board voted to make in their kids. And that's amazing. And they have the highest lunch participation rate in the county to show for it. So this works and it's awesome. And I just really want to give them full credit for that. Last but certainly not least, I would like to talk about the summer food service program and the seamless summer option. These are summer food programs for kids that operate outside of school in the summertime when school lunch is not available, because we know kids are still hungry in the summertime, more likely to be hungry in the summertime, in fact, because they don't have access to school lunch. There's some opportunity for improvement in this program in Adams County as well. As of last summer, there were only 2 sites and both of them were in Gettysburg, but there are eligible areas elsewhere in the county, and opportunity to use a new provision called the non-congregate rural provision, which allows sites to open and do lunches where you can come and pick up like a week's worth of lunch at a time. Makes it much more accessible for kids in rural areas where they can't just walk themselves to the park, right? So these are all awesome things that we can talk about. But moving off of government programs, we know that folks who are facing food insecurity are not food insecure for no reason. There's something going on that's causing that, that's intertwined with that, as we'll talk about health certainly in a moment. But there's a number of sort of root causes and things that intersect and align with food insecurity that we want to talk about, because we don't only want to help folks while they're experiencing food insecurity, we want to prevent it from happening, and we want to help them get out of it if they're experiencing it. And the way to do that is to address the upstream and intersecting issues. So, number one here is income. Income is the national data that we have is that the strongest determinant of food insecurity is income. It's poverty, ultimately. And what we see here is that the main household income sources among pantry visitors in Adams County are Social Security and pension, so these are people who are retired, full-time work, so these are people who are working hard but just can't make their ends meet, and people who are on disability or Social Security SSI. And these are people who are unable to work because they are disabled. 86% of pantry visitors in Adams County fall into one of these 3 buckets. And there is a popular stereotype that food pantry visits are driven by unemployment. It's not true. It's just patently not the case. And this is a consistent finding that we have across our entire service territory where we've done this so far, is that folks are retired, working, or disabled, and they're doing their best and they just can't make it work. I want to talk a little bit more about folks who are working specifically, because we found in Adams County that folks who are working full-time are actually the most likely to experience very low food security among the pantry visitor population. 41% of folks who are working full-time and visiting a food pantry in Adams County are going hungry still, even though they're already seeking assistance. This really speaks to irregular work, maybe seasonal work, whether that's in tourism or agriculture, the inadequate wages, a number of things here. And then not that far behind are folks on disability or SSI, which again speaks to inadequate benefits, quite frankly. Seniors are the least likely to experience very low food security. Zach touched on this a little bit earlier. 20% of seniors experience very low food security, which is still too many. But this sort of points at the effectiveness of Social Security and Medicare and other social net programs for seniors being effective and working, which is great. So all of this to say, these things are super important. And folks who are working full-time, a third of the folks that we spoke with who are working full-time are making less than $24,000 a year. For a household of 3, that's below the federal poverty line. And most of the full-time working pantry visitors, a third of them are below 100% FPL for their household size, and 75% are below 150% of the federal poverty line, which is that itself below the eligibility for federally funded food programs in Pennsylvania, like TFAP. So there is very clearly a substantial need to better support working folks. All of that to say, this is another reason why it's important for pantries to think about their hours of operation in particular, and being accessible for working families and households with children, and also dispelling myths about who's coming to the food pantry and why. This is something that really goes a long way towards preventing stigma and breaking down stigma. So these are all really important things for us to sort of think about moving forward. I got a little bit ahead of myself. I already talked about this particular graph. I get really excited about upstream and intersecting issues, and I'm not sorry. So as I said, folks who are working in Adams County are most likely to be experiencing very low food security. If you are in a call your legislators mood, minimum wage, it's a thing that maybe could go up. So there are definitely some opportunities there as well. But there are other drivers of food insecurity. It's not just income. Housing precarity is an important driver of very low food security as well. 11% of pantry visitors in Adams County had experienced an eviction or foreclosure in the last year, and 21% are worried about it. That is significantly higher than the overall population eviction rate. And this is another finding that we have that's consistent across counties where we've done this work. Folks who are unstably housed are disproportionately likely to also be food insecure, and the reverse. And we see consistently as well that folks are really, we ask a question that's like, hey, have you had to make a choice about which bills you're gonna pay and if you're gonna buy food versus paying a bill? And folks are telling us, I pay my rent first, but that leaves me short for food. Or I've had to skip my utility bills so I can afford my groceries. And you can see these results right here. And again, that the effects are particularly severe for households with children. Half of Adams County food pantry visitors with children that we spoke with in surveys skipped a utility bill, or cut back on a utility bill, or cut back on their groceries to afford their utility bills. And half also did the same thing with their rent or their mortgage. Which is, that's a lot. And so there are opportunities for us to do things about housing and to work on housing. Some of these things that any pantry can do are providing information about LIHEAP and eviction assistance and all of these things, because I know there are awesome housing organizations here in Adams County that can help. But also there are opportunities to expand on this and collaborate with other organizations, whether you want to start doing some eviction prevention yourself or work with other organizations. And I know At Home Adams County is here and doing super amazing work on that too. So there are a lot of opportunities for us to make sure that folks can be safely and stably housed, and that can help them with their food security situation too. A couple other drivers. I touched on disability a little bit earlier, but I want to talk about it again because it's really important. More than a third of our pantry visitors who are relying on disability or SSI for income are experiencing very low food security. This means that these people are effectively being legislated into food insecurity because their benefits just aren't enough for them to live on. This is something that we can advocate about. Advocates can back efforts to increase benefit adequacy and add program reforms that will help disabled laborers live less precariously. Specifically, there are proposals to expand access to ABLE accounts, which are savings accounts that allow folks who are on disability to accrue assets that they can build their own personal safety net above and beyond the disability asset cap, which is $2,000, which is not adequate to build a personal social safety net with, of course. So these are things that we can support as a charitable food network that can help our disabled neighbors be more independent and live more sustainable lives. So financial access. This is another one that sometimes when we talk about this one, people sort of give me the skeptical eyebrow, like, why are you talking about this? Financial access is super important, and access to the traditional financial network is important because it's expensive if you don't use a bank account to get your money. If you are already not making a whole lot of money and then you have to go to a check cashing service to get your check cashed and pay 10% off the top, that's money that you could be spending to pay your light bill that you are just losing somewhere, right? So Adams County pantry visitors are about 5 times as likely to lack access to the traditional financial network as the average Pennsylvanian. The rate is 2.6 among the average Pennsylvania, but 14% of Adams County pantry visitors don't have a bank account. Another 16% of Adams County pantry visitors do have a bank account, but they told us that they went to a check cashing service or a money order place or some other sort of alternative financial service within the last year. And so this tells us that there's some opportunity to ease that burden of fees and just the cost of using alternative financial services by collaborating with local financial partners to sort of get folks connected, to capitalize on bankable moments like tax time, to sort of say, hey, you're gonna get this direct deposit. What if you opened a bank account for it? And do things like that to sort of help folks get connected to a more sustainable way of accessing the money that they worked hard to get. And I said earlier I was going to talk about healthcare. This is the health conditions part. Since we started asking this question as part of our community hunger mapping projects, we consistently find that substantial proportions of pantry visitors have a diet-associated health condition. In Adams County, 51% of surveyed households have at least one member with at least one chronic health condition related to diet. The most commonly cited dietary condition was diabetes. About a third, 36%, with hypertension as well. And then a unique finding for Adams County is that 9% of the folks that we spoke with had a household member with kidney disease. This is significantly higher than we found in our other counties. And we think that this is related to the fact that the county is rural and has a large community of agricultural workers, because there is research showing that folks who live in rural areas, and specifically who work in agriculture, are disproportionately likely to develop renal disease. So this is just something for our friends at WellSpan in particular to think about, but something for us as the Charitable Food Network to think about too, because these are all things that may limit what you are supposed to eat. And so we should offer folks the food at the pantry that will work for their health conditions as well, if we are able to do that. So I do want to take a moment again to thank WellSpan for their investment in this program, or in our work, and in the charitable food system, and just thinking about food insecurity as a social determinant of health, because it is. And it's really important that we address that if we are interested in making sustainable change. So I've talked a lot. We've all talked a lot. Thank you for listening. So after we've thrown all of this data at you, the next obvious question is, what do we do about it? And the good news is that there is something everybody in this room and everybody outside of this room can do. And what specifically that something is going to vary depending on who you are, depending on who you work for, depending on what you care about. But there is something that everyone in this room can do to take action for our neighbors who are facing hunger. And it is Hunger Action Month, so please take action. Charitable Food Network, which I know many of you are or are associated with, we've sort of talked about how the Charitable Food Network in Adams County is really friendly and people think it's really low barrier. Lean into that. That's super important. You're getting people in the door, and in addition to providing them with food that they need, you can get them connected to other resources that can help them with some of the upstream and intersecting issues I talked about. You can get people connected to SNAP, you can get people connected to WIC, you can do all sorts of really cool stuff just by building that community and leaning into the fact that people are already coming to you. If you are not part of the charitable food system, you can certainly become part of it. Charitable Food Network loves volunteers. We love volunteers. And volunteers are great if you can support the Charitable Food Network with your dollars. Certainly it's a challenging time right now, and that would be very welcome. There are a number of things that anyone can do. And even if you are outside of that and you're representing another sector today, if that's healthcare, if that's business, if you're a school district, whatever you are, take the ethos of this report with you and think about what you can learn, and think about how you can use information that you have to make sustainable changes, and how you can support your neighbors. Because there is, even if you're not working on food insecurity, I think there are things that we can all work on together that are really meaningful and helpful and can make change. So we're excited to continue to work with our stakeholders here and online. Hi, online folks, thank you for being here. We're really excited to get to the work. This moment is a capstone on a year-long project, but it's also the beginning of a new one. And the new one is the most important one, where we actually make change for our neighbors. And we're so excited to do that with all of you. So with that, I will open the floor for questions. Please scan the large QR code. That's the one for the report. It would make me personally very happy if you scanned the red QR code in the lower left-hand side. That one is for our policy blog. I manage that. So if you're interested in what we talked about today and you want like bite-sized things in your email inbox twice a month, scan that QR code, please. We would love that. But with that, I just want to thank you all for listening and open floor for questions.
All right, any questions on any of the information presented so far? Yeah, go ahead.
So you talked about the underbanking, and I know that means the different mobile apps with depositing, but does that include the apps like Klarna, where it's buy now, pay later, or installment type things?
Yeah, so really it's how people perceive that question. So we asked the question from the FDIC essentially on banking access. And so the examples given were primarily things like accessing a check cashing service, or taking out a title loan on your vehicle, or a variety of other like kind of traditional things. So I would say primarily does not include that, so folks could have access to those things too. So if they use those alternative financial services, they would be classified as either underbanked or unbanked. And if you're underbanked, you have a bank account, but you also use these other services too. Yeah, go ahead.
I'm just wondering, I recognize a lot of the places here,
but I wonder if any of this is new to the audience.
That's a great question.
Any part of it. I mean, there were some things that were new to me, and I've been working on this one way or another. But I'm wondering if anyone else found any of that data surprising, which is okay. I mean, a lot of people do not know that hardworking people are going hungry.
Yeah, yeah. Is that the primary takeaway that you had? Yeah. Yeah, and I'll say a lot of these things, like we didn't know these things as well before we started the research, and that's why we invest in this. But yeah, I'll open that question up to anybody. I know we're also going to pass it to Carly, and we'll do a debrief and next steps for the Adams County Food Policy Council, so we can talk about it then as well. Thank you. Anybody online? I actually am not. No? Okay, excellent. All right. Well, with that, we're going to pass it off to Carly. We might take a few-minute break so you can get up and get some snacks or coffee in the back. Thank you all so much for coming. We're looking forward to this next step and to working in collaboration with you all to reduce food insecurity. Thank you.
You could at least stand up, stretch your legs. If you didn't get a cookie, you're missing out because shameless plugs for Servo cookies. Is this real? Is this like juicy into it? Yes, good choice on the cookies. Okay, so hi everyone. My name is Carly Aki, and I chair the Adams County Food Policy Council here, along with a lot of my awesome colleagues that I will introduce throughout these next few minutes together. There you go. So just a little overview of the vision for the day. We're going to talk a little bit about who we are, what we do, some of our successful food programs, have time for questions, and then split into groups to talk about some of the takeaways that we got from those fantastic presentations from everyone, and how the Food Policy Council can play a role in implementing some of these things and bringing these things into an action plan state. So that is the vision, but please feel free to stop me throughout any point if you have a question. So this is our mission, so I'll give you a second to read that. Kathy definitely gives a better pitch about our origins and whatnot, but I will not put her on the spot. But the short, but the short answer is that, sorry, Kathy, now I'm distracted. Okay, but the short answer is that the Food Policy Council, we are more than just the charitable food network. We also look at the economic side, wellness, the environment, and we bring together a network of organizations. So even though it feels like it's everyone in the charitable network out here doing the thing, which is true a lot of times, what's unique about the Food Policy Council is that we do engage folks at the other levels and from other industries to help make our work happen and make it count. So this, we actually recently restructured how we're organized as a Food Policy Council. So now we have 3 different levels of membership. So general membership is our most basic, top tier umbrella level. That's you. Because you're here, you obviously have an interest in food access, food costs, whatever it may be. So those are our network of organizations, businesses, farmers. We don't have any restaurants in our network actively, but it'd be cool if we did. Nonprofits, we have folks representing government agencies and so much more, the school board and school service, food services. So our general membership is broad. We have quarterly in-person meetings at SCAP, and we are this close to launching our first monthly newsletter so that folks get to stay informed about what's going on in Adams County. So raise your hand if you've ever been to one of our general membership meetings. Good answer, Kathy, you passed. Awesome. So just to give you a feel of who's in the room and who's ever been to one of these. Next up, we have our Leadership Council. So hands up for my Leadership Council friends. Hello, Leadership Council friends. So there's 8 to 10 of us. Not all of us are in the room right now. We're from various parts of the food system. We have monthly meetings to guide the work of the council. Whenever there's a question, we work on the strategic plan, the big term, long-term goals and mission. It also includes our working group leaders, which I'll get to next, and all of our members are also on at least one working group. So that's our leadership. Now raise your hand if you're a working group leader. Yay. Oh, wait, yeah, I was going to say there's at least 3 of you in here. And raise your hand if you're on a working group in some capacity. Yeah, so our working groups meet monthly, sometimes less, sometimes more, depending on what's going on. We have 4 standing groups: community engagement, communications and marketing, policy and advocacy, and food programs. And then we have ad hoc working groups as needed. Right now we have one for emergency services and our collaboration with them. So if any of this is interesting and you didn't raise your hand at any point, come talk to us or to someone that did raise their hand about getting involved in one of these capacities. We have lots of community partners. If I put everybody's logos on here, you wouldn't even be able to see them. So I just wanted to highlight some of the ones that really make the work happen. A huge, huge, huge shout out to the Gettysburg Hospital Foundation. Stephanie Foy?
Oh, yeah, from WellSpan?
Yes, stepped out, but without the community grants that she talked about and without Kathy's amazing grant writing skills, most of our programs wouldn't come to life. So I just wanted to highlight our partners and talk a little bit about what we do. So this is a screenshot from our website, but I thought it was representative because it highlights a lot of the key initiatives of the Food Policy Council. So what we do, we run a bunch of food access programs that we'll talk about. Some have already been mentioned, and we'll dive into those a little bit more. We have a dashboard that is getting a facelift. So if you need any kind of data about food insecurity, economic reality, health outcomes, non-medical factors, all those kinds of things are represented in the dashboard. So it's a big data spreadsheet right now, but it's getting a facelift to be a little more digestible, have a little more narrative to it as well. We also have our local food resource guide, which Sarah Weigel from County Planning has done a fantastic job to make it a very navigable map that you could interact with. We also have paper versions for our folks that don't have internet access. And we don't just have the local food, we also have maps of the charitable food network that we work really hard to maintain and make sure that they have accurate information on them. So I want to dive into some of our food access programs because they're awesome and very high impact. So first up, we have Fruit and Veggie Bucks, which we're registering for right now. We are already at over 300 applications, which is super exciting because they only started like September 6th-ish. So that's a lot of signups. Yeah, and it's largely in part to the amazing volunteers at SCAP and to my new bestie that has been entering all of the paper data because people do not like tablets or Google Forms. They like paper, and that's okay, except when their handwriting's really bad, and then we can't put them in the program. So the team at SCAP has been really, really great about verifying the handwriting first and then entering it all digitally. So it's been pretty seamless considering the volume that we've had. So this program, once they're signed up, this is for folks that receive SNAP or otherwise qualify, because again, as we know, there's a lot of families that are eligible for SNAP but don't get it for whatever reason. So folks that would qualify or already receive it, whenever they go to Kenny's, once they're signed up in this program, and it's any of the Kenny's locations in Adams County, so Littlestown, Biglerville, and Gettysburg, they get a 50% off discount on all of the items in the produce section, up to $25 a day. So it's really great. And then sometimes at the end when there's a lot of funds, it's like a 100% discount. So we send out through a text messaging system reminders about that, and it's a really great program. The counterpart to that, which runs in the winter, is SNAP Double Dollars that was referenced. So this takes place at the farmers market. The recipients when they swipe their EBT card to redeem those benefits, also get tokens or script on SNAP transactions. So again, it's another one of these really beautiful, mutually beneficial. All of those growers and producers at the market get more income from these chips, and people get access to food, and they get to stretch their SNAP dollars. And the market's been doing a great job with triple SNAP days. They've been really, really successful as well. So yeah, if you're also looking to call your legislator about anything, which one's that? PA Food Bucks. That's the one that would bring more funding to make these programs happen either more frequently in more places, or make it triple all the time, not just double. So if you're taking notes for calling. Next up, we have Military Share, which is a free distribution, also partnered with the Central PA Food Bank. So for Adams County veterans or surviving family members, it's a once a month, you register and you come through. It also takes place at the not the farmer's market, at the rec park, thank you. Once a month, drive through and get a box of food. We also have SFMNP and regular FMNP. So raise your hand if you know what FMNP is. Okay, that's fine, I can do it. Farmers Market Nutrition Program. So the S is for seniors. Those go out through our Office for Aging. The regular FMNP goes out through our WIC office. So it's for seniors and WIC recipients to get access to more fresh produce and everything. So there, you can spend them on fresh fruits and vegetables. You can spend them at the farmers market. Some of the other local growers will accept them like right in their like farm stores, like I think Hollowell's does and a couple others. But at the farmers market, you can get the value of the check plus another matching token to stretch those dollars even more. And in response to the check amount, dollar value going down, we're looking at increasing that amount so that people don't feel the impact of that benefit as much, that benefit being cut. And next up, we have our Healthy Options program. It's kind of our, what is it, like vanguard, our pilot program of the Food Policy Council. This happens also at Kenny's and the farmers market. There's families that are registered and seniors. The very first program started in 2011 with 25 families at the farmers market. And now there's 180 families and 150 seniors. This is why I don't go off script and I have to make eye contact with Kathy. So obviously huge growth there, and the need continues to grow. I think, Josie, are we back at is there another wait list already for this family program? Yep. So the more people hear about this program, it's very low barrier to access and to apply. But again, this one is designed so the other programs are for SNAP eligible families. It's all about stretching those dollars. This is for folks that are in that food gap. So they make $1 more than what the SNAP limit allows, and all of a sudden their spending power has gone from here down to here. So we try to get them back up to here. So that's what the Healthy Options program is. I was formerly a coordinator for the program. Josie's the current one, and she's doing a fantastic job with bringing back programming for the families that are participating to also do some healthy cooking demos, some social events, some walks, things like that to make it just a more holistic program experience. So that was super fast. Any questions about those? A lot of folks in the room are familiar, so that's cool. Any questions about anything? Food Policy Council related, not the first stuff. That's all done. Okay, cool. So my vision for this next step is that if you want to shake up your tables, I know some of us are in our clusters of safe people, but maybe if we want to shake it up, meet some new people, and if someone in your group can just be a scribe to write down what is sticking with you from the data that we just heard, and then you just heard what the Food Policy Council does, what are the action items we can take? What are some of the things that are already existing, the small tweaks, the easy lifts that we can do to try to address some of the things from the data we just heard? So we'll do that for like 7 minutes, and then we'll share out. I think that's math. Okay, so I didn't get a chance to visit the other two tables. I feel like we could keep talking for the next hour and come out with a beautiful strategic plan, and I love that for us. But we don't have that kind of time. So I was wondering if someone from each table would just want to share a couple highlights of what your group talked about. I'm going to nominate table 1. I'm not the representative from table 1. Okay, so at table 1, we were all pretty stunned by the underbanked and unbanked statistic. It also feels like a pretty easy reach, but it's not just a matter of getting people signed up, it's also education. So Kathy, because Kathy knows everyone, has connections. We were talking about some of the banks and the requirements and who's not accessing them. So getting clarification about if IDs and socials are required at which banks to open accounts, and then also it'll be some retraining too of people heard, oh, you need a government ID to open this account. So now letting them know, no, you don't at this, and this is how fees and minimum balances work, and these are the accounts that don't have those things versus some of the other ones. So we talked about that in a couple different settings. So that's a highlight from our group. Representative from table 2.
1/3 working people make less than $24,000. Low participation in free and reduced meals. The stats are average daily participation, not total enrollment, and that's an explanation. Adams County has a tremendous need, despite our great work.
Right.
And I'm sure I missed a few.
No, that was great.
Yeah.
And we didn't address low-hanging fruit yet.
Yeah. Thank you, group 2. And group 3?
We run out of time. Because our goal was to fix all the problems. But we got to introduction. So in my group, we had Donna, who is representing John's Meals and also volunteer at cleaning. Leah, Pam, and Sammy, representing New Hope Ministries. And Julie, who is a volunteer for the Community Foundation and also a former representative from CPS, and myself, working for Wellspun. Two of the things that stood out that we were able to do after introductions was the data that showed that McSherrystown had one of the highest percentages of food insecurity. And in the conversation, we talked about the demographics, having a higher senior population, in transportation, which may have an impact on that. And Sammy also has data from other previous work that for her this data was important because it kind of highlighted some contrasts with other indicators. The second thing we discussed was also the number of people who are not signed up for food assistance programs, specifically for Littlestown. Yeah. And some of the solutions to this problem that we brainstormed before we run out of time was to provide in-person navigation beyond just giving someone a website or digital format that people may have challenges to remember passwords and things like that, or a phone number which sometimes is not fully staffed and people cannot get back to people that are trying to sign up for that, or something beyond the assistance office, more like mobile navigation support service. That's it.
Thank you. Well, thanks everybody. That was awesome. Alana.
Just a really quick plug here, and it's just an idea. So I met earlier today with Miranda Weiser, as Executive Director of Adams County Library System, and the library system was able to acquire a lot of laptops that are now available across the different branches, and she is desperate to have people coming in and using them. I see this as an opportunity for us to direct people to free resources, to have an opportunity to say, are you signed up for resources? Maybe we can give a script to the librarians to say, you know, let's check, are you involved in these things? And then give them, maybe we create a little tool sheet that says, are you connected to John's Meals, Ruth's Harvest, to the pantries, you know, to XYZ benefits? Like, let's just see how we can leverage a free resource with all of these laptops that she wants us to use. So here's an option.
I could actually speak to that a little bit. For some of the non-food pantry surveys that we collect, we do those largely at libraries, other publicly available places, and I've had pretty much unilateral agreement from all the librarians in every county that we've done. Anytime we've asked to put a survey on the homepage or anything like that, so certainly something like a screener for SNAP and abilities to connect people to those resources, I think would be amenable to that population. Yeah.
Awesome. Great. Well, Katie was taking notes for our group, so we're going to bring that back. So if you're on the Leadership Council, let's chat about these things next time. But thank you all so much. Katie, is there anything else? Awesome. Thanks everyone so much.